Did you know that 1 in 3 people will develop cancer in their lifetime? According to the World Health Organization, WHO, this statistic highlights the global prevalence of cancer and underscores the importance of early detection and prevention strategies in reducing its impact. Despite significant advancements in medical technology, millions of cancer cases are diagnosed too late every year simply because early warning signs are overlooked. Early detection can mean survival rates above 90% for many cancers, while late detection can reduce this rate to below 20%. This comprehensive guide delves into 8 subtle warning signs of cancer, supported by scientific evidence, personal insights, and real-life examples. By the end of this article, you will be equipped with the knowledge to recognize these signs and take proactive steps toward health. 1. Persistent bone pain. Bone pain that intensifies over time, particularly at night, can be a sign of cancer affecting or spreading to the bones. This type of pain often results from cancer cells weakening the bone structure, causing microfractures or inflammation. Unlike pain from minor injuries, this discomfort progressively worsens, resists regular pain relievers, and may be accompanied by swelling or tenderness. Consider a 45-year-old woman experiencing a persistent ache in her left thigh. Initially dismissed as a muscle strain, the pain grew unbearable. After months of discomfort, she sought medical attention and was diagnosed with early-stage osteosarcoma. Prompt treatment led to a full recovery. Seek medical evaluation if bone pain is accompanied by swelling, tenderness, or unexplained fractures. These symptoms could indicate tumor-related inflammation or weakening of the bone structure, which can lead to further complications, including fractures and reduced mobility. Addressing these signs early allows for diagnostic imaging or biopsies that could confirm or rule out malignancies, facilitating timely and potentially life-saving interventions. Early detection can dramatically improve outcomes, as studies show that cancers caught in early stages often have survival rates exceeding 90%, compared to less than 20% for advanced stages. For example, a meta-analysis published in the Journal of Clinical Oncology highlights the direct correlation between timely diagnosis and effective treatment outcomes. 2. Eye pain and vision changes. Ocular melanoma, though rare, often begins subtly. Symptoms include blurred vision, flashes of light, or a growing dark spot on the iris. People with fair skin or light-colored eyes are at higher risk because these features provide less natural protection against harmful ultraviolet (UV) rays, which can damage DNA in the eye and increase the likelihood of mutations leading to cancer. A man noticed a dark speck in his vision that persisted for weeks. After an eye exam revealed ocular melanoma, he underwent successful treatment. Regular eye exams are essential to detect potential issues early. Individuals with prolonged sun exposure or a family history of eye cancer are at heightened risk. The UV radiation from the sun can damage the delicate tissues in the eye, increasing the likelihood of DNA mutations that lead to cancer. This is especially critical for those with fair skin or light-colored eyes, as they lack the natural pigmentation that offers some protection against UV rays. Annual checkups or more frequent screenings based on personal risk factors can catch early changes that might otherwise go unnoticed, paving the way for timely and effective treatment. 3. Unexplained rashes or skin changes. Leukemia can manifest as petechiae, tiny red or purple spots caused by a platelet deficiency. These spots result from a significant drop in platelet levels, reducing the blood's ability to clot effectively. Unlike common rashes, petechiae don't fade when pressed and often cluster around pressure areas like the ankles. Their appearance is a visual clue to potential underlying hematologic issues, such as leukemia, where the bone marrow's production of blood cells becomes disrupted. This disruption can also lead to accompanying symptoms like frequent bruising or prolonged bleeding from minor cuts. A young mother dismissed unusual spots on her legs as an allergic reaction until she began experiencing frequent nosebleeds. Tests revealed leukemia. Early intervention saved her life. Persistent or unusual rashes warrant a medical checkup, especially when paired with unexplained bruising or bleeding. 4. Changes in nails. Subungual melanoma, a rare and potentially aggressive form of skin cancer developing under the nails, often begins with a dark streak that progressively evolves in size, shape, and color over time. Unlike bruising or trauma, This discoloration typically doesn't resolve on its own and may extend beyond the nail bed. Additional symptoms include persistent pain, nail splitting, bleeding, or changes in nail texture. If untreated, subungual melanoma can metastasize to other parts of the body, significantly impacting overall prognosis. A runner's dark streak under her toenail was misdiagnosed as trauma. A dermatologist's biopsy later confirmed melanoma. She credits her persistence for her timely diagnosis. Monitor nail changes closely, especially if the pigmentation spreads beyond the nail bed. 5. Persistent night sweats. Lymphoma-related night sweats are episodes of intense sweating that can drench bedding and clothing, disrupting sleep and overall quality of life. These sweats are often accompanied by additional symptoms such as fever, unexplained weight loss, and persistent fatigue. They occur as part of the body's systemic immune response to cancer, particularly lymphoma, where inflammatory cytokines and other chemical mediators are released in response to the malignancy. This process disrupts normal thermoregulation, leading to excessive sweating. Night sweats associated with lymphoma are distinct from those caused by environmental factors or hormonal changes, often being more severe and recurring without a clear external trigger. My research over decades reveals that recurring night sweats often signal a systemic issue. These sweats should not be dismissed, particularly if paired with other B symptoms. Consult a doctor promptly if you experience night sweats that are intense enough to drench your bedding or clothing and are not explained by typical environmental factors or menopausal changes. Pay particular attention if these night sweats are accompanied by other systemic symptoms such as unexplained weight loss, fever, or persistent fatigue. Early evaluation can help rule out serious conditions like lymphoma or other underlying health issues, ensuring timely diagnosis and treatment. 6. Chronic heartburn. Persistent heartburn that resists medication might be an early warning sign of esophageal cancer. Chronic acid reflux can progressively harm the esophageal lining, leading to Barrett's esophagus, a precancerous condition marked by changes in the cellular structure of the esophagus. Over time, this damage increases the risk of developing esophageal cancer. Identifying and addressing heartburn symptoms promptly can help prevent serious complications. For instance, individuals experiencing difficulty swallowing or unexplained weight loss alongside persistent heartburn should seek immediate medical advice, as these could be indicators of advanced esophageal complications. A teacher's frequent heartburn turned into difficulty swallowing. Tests confirmed early esophageal cancer. Her treatment was successful thanks to early diagnosis. If heartburn persists beyond 3 weeks despite treatment, it could signal a more serious underlying condition, such as esophageal cancer or other gastrointestinal disorders. Persistent acid reflux can damage the esophagus over time, increasing the risk of complications like Barrett's esophagus or even cancer. It's crucial to seek medical advice promptly for proper evaluation, which may include diagnostic tests like an endoscopy to identify potential abnormalities and begin appropriate treatment early. 7. Jaundice. Sudden yellowing of the skin and eyes, medically known as jaundice, can be a significant indicator of underlying pancreatic or liver cancer. This occurs when tumors obstruct the bile ducts, leading to a buildup of bilirubin, a yellow pigment formed during the breakdown of red blood cells. When bile cannot flow properly due to these blockages, bilirubin accumulates in the bloodstream and deposits in the skin and eyes, causing the characteristic yellow discoloration. Accompanying symptoms often include dark urine, light-colored stools, and itching, which provide further clues to potential liver or pancreatic dysfunction. Recognizing these signs early is critical, as timely medical intervention can significantly improve outcomes. A business executive noticed yellowing eyes during a stressful week. Further investigation revealed early pancreatic cancer. Early treatment extended his life significantly. Watch for jaundice accompanied by dark urine or light stools, as these signs often indicate a buildup of bilirubin due to blocked bile ducts. Act swiftly by consulting a healthcare provider, as timely intervention can address the underlying issue and potentially improve survival rates in cases of pancreatic or liver cancer. 8. Persistent fever. Recurring, unexplained fevers can signal blood cancers like leukemia or lymphoma. These fevers often occur without an apparent infection and are part of a systemic immune response. A college student's recurring fever and fatigue led to a leukemia diagnosis. Early chemotherapy saved her life. Persistent fever lasting over 2 weeks warrants thorough investigation. Recognizing these 8 warning signs can save lives. While not every symptom points to cancer, staying vigilant and proactive about health is crucial. Regular checkups, listening to your body, and acting promptly on unusual changes can make all the difference. As a researcher and practitioner, I've witnessed the transformative power of early detection. Each of these warning signs holds a story of survival when acted upon in time. Let this knowledge empower you to prioritize health and inspire others to do the same. Share this guide with your loved ones, and don't forget to consult healthcare professionals for any concerning symptoms. Early intervention saves lives. Your health is your wealth. Stay informed, act early, and embrace a proactive approach to well-being.